Hi, my name is Jessica and I'm here today presenting to you a class we call Welcome to Medicare. This class is offered through the Aging and Disability Resource Center of Door County in person, but we've recorded to make it more convenient for you to watch at a time or place that works best for you. This is what I would call step one, which is starting to learn about Medicare. Medicare can be a complex insurance system, and understanding all the parts and choices can be very confusing. This is put together for you to help you feel more informed and comfortable and prepared to make Medicare decisions. This program is supported by SHIP. SHIP is funding in whole or part by certain grants, as you can see here on this slide. As mentioned, this class is hosted by the Aging and Disability Resource Center of Door County. I'd like to give you a little introduction to what the ADRC is. The Bureau of Aging and Disability Resource Centers in the Department of Health Services coordinates ADRCs statewide, so each county has an ADRC that provides services similar to ours. ADRCs across the state connect people who are aging or living with a disability to resources that help them meet their needs, make informed choices, and access resources. ADRC services are available to individuals who are 18 and older with a disability, youth that are 17 and a half, preparing to transition into adult services, and adults who are 60 or older. Some of the programs housed by the Door County ADRC include Family Caregiver Support, Dementia Care Specialist, Nutrition Programs, ADRC Specialist, Benefit Specialists, and Long-Term Care Counselors. This specific class, Welcome to Medicare, is presented to you by the ADRC Benefits Specialist Program. I am the Elder Benefits Specialist at the ADRC of Door County. Benefits specialists are trained to help persons that are older or living with a disability over 18 who are having problems with their public or private benefits. We receive ongoing training to understand public benefits so we can help you understand and monitor and access public benefits that help you. We are overseen by knowledgeable attorneys in elder law and disability rights. I'm also a SHIP counselor. SHIP and the logo here is something you might see on information you get about Medicare, as SHIP provides free, in-depth, and unbiased information about Medicare. This is a national effort to help beneficiaries, their families, and caregivers understand Medicare. I've put this class together to give you a very comprehensive overview of Medicare. I've tried to address many of the common questions along the way that I receive at our office. This slide shows you that we'll cover everything from how do I enroll in Medicare, through the parts of Medicare and understanding the insurance options and what each part covers, ways to afford Medicare if you have limited income and resources, and how to protect yourself from Medicare fraud. A great place to start is understanding how to enroll in Medicare and when to do that. Medicare is considered a federal health insurance program. We pay into Medicare throughout our working years. This insurance program is meant for individuals who are 65 or older, those under 65 who have a qualifying disability, or those of any age who have end-stage renal disease or ALS. Since your situation might vary from person to person about how and when to enroll in Medicare, let's start there. The ways to get your Medicare started will depend on whether or not you receive Social Security benefits. If someone receives Social Security benefits, whether it's retirement, widow benefits, survivor benefits, or disability, you'd be automatically enrolled, meaning you don't need to complete an application, and your Medicare Part A and B, which we'll talk about more later, will start in the month you turn 65. Your materials and card are typically sent to you about 3 to 4 months before your 65th birthday month. If you're close to 65, you currently don't have Social Security, you enroll by making an application for Part A and B with Social Security during your initial enrollment period. The application for Medicare being done through Social Security can be done in a couple ways. Social Security encourages us to make an online account on Social Security's website, which is listed here on this slide, and to do your application on their website. If you don't have access, or this is not an easy way for you, you can also call Social Security requesting an appointment for help. You can call either the numbers listed on this slide and let them know you'll need assistance with your application. You will be scheduled an appointment and someone from Social Security will call you to do your application over the phone. If you are under 65 and on disability, a program called SSDI, you're automatically enrolled in Medicare also after you receive 24 consecutive months of SSDI benefits. If you are not on Social Security before turning 65, you will not be automatically enrolled and will need to submit an application. Your first opportunity to apply for your Medicare is during your initial enrollment period, or IEP. This is a whole 7-month window that sandwiches your birthday. The image here shows you months 1, 2, and 3, which are the 3 months before the month you turn 65, month 4, which is the month you turn 65, and months 5, 6, 7, which are the 3 months following the month you turn 65. This is a full amount of time that you're allowed to submit your application to get your Medicare started. Your coverage, however, starts based on when you submit that application. If you submit your application for Medicare in one of the first 1, 2, 3 months, the 3 months before your birthday, your Medicare will begin on the first of the month you turn 65. If you wait to apply in the month you turn 65 or the 3 months after, your coverage will start the month after you submit your application. It's important to understand this timing so you can apply at the time you need to make sure coverage starts when you need it. Example, if you were born on June 10th, your initial enrollment period starts on the 1st of March and it lasts through September 30th. The date you were born doesn't matter as much unless you were born on the 1st of the month. If you're born on the 1st of a month, your initial enrollment period begins like you were born 1 whole month early. Example, if you were born June 1st, your initial enrollment period actually begins as if you were born in May, meaning your window starts February 1st and goes through August. Other times you can apply for Medicare is if you're covered under what we call a special enrollment period, or SEP for short. The most common SEP is that you waited to enroll in Medicare because you were still covered by a qualifying employment plan, a health insurance plan through a job. Other special enrollment periods can be the loss of Medicaid coverage, you missed the chance to apply due to a natural disaster, you missed your chance to apply because of inaccurate or misleading information you were given from a health plan or employer, or because you were incarcerated at the time you were able to enroll, or a volunteer serving in a foreign country. If you're able to enroll because of a special enrollment period, you will not be subject to late enrollment penalties, which we'll discuss later. Another opportunity to apply is the General Enrollment Period, or GEP. This is an annual window that starts each January 1st and lasts through March 31st. This is a window for those who did not enroll when they were first able to and do not have a qualifying special enrollment option. Enrolling during this general enrollment period may mean a gap of coverage as well as penalties. A very common question and topic that gives a lot of confusion is what to do if you're still working and turning 65 and you have insurance through a job. It's pretty common people continue to work when they turn 65, so it's very important to be clear about these points. You can delay enrollment in Medicare. You do not need to apply as long as you meet the following criteria. You or your spouse are actively currently working, and you are covered by an employer plan that has at least 20 or more employees, and you are continuing to work and be covered by that plan. As long as your plan is considered creditable, you can decide not to enroll in Medicare if that makes the most sense. Learning about Medicare, though, is really important so you can compare it to your current insurance and decide which will work better for you. If you work for an employer that has less than 20 employees, you would incur a penalty if you do not take Medicare at 65, even if you do still plan to keep working and keep your insurance through that job. If you're still working and decide to wait for Medicare, you can enroll in Medicare at any time while you're actively still employed. You are covered under a special enrollment period, but you must enroll in Medicare within 8 months of either you stop working, whether you quit or retire, or you lose health insurance through the job. Whichever occurs first starts the 8-month window where you must enroll in Medicare. After 8 months, a late enrollment penalty could apply to you, and you would need to wait till the general enrollment period to apply for Medicare. You need to know that COBRA or retiree coverage are not treated in the same way. They are not considered active employer coverage. If you have COBRA or retiree coverage and you do not enroll in Medicare during your windows, you also could incur a late enrollment penalty and need to wait till the general enrollment period to apply for Medicare. So if you are still working and turning 65, we encourage you to talk to your HR or whoever oversees your insurance at your job. Ask if there's any changes to your requirements to enroll in Medicare or their coordination of benefits if you are eligible for Medicare. You can also contact Social Security with questions about your eligibility and requirements to enroll. A special side note for those that are continuing their insurance through their job, if you have an HSA style plan, a health savings account, there are some IRS rules that state that you cannot contribute to an HSA while enrolled in other types of insurance like Medicare. If you do have an overlap of the two, you can incur a penalty. So as we'll discuss later, sometimes individuals, even if they are going to stay on their qualifying work plan, will enroll in certain parts of Medicare because they are cost-free. However, you would not want to do that if you're continuing to contribute to an HSA. You would want to avoid doing that to avoid this IRS penalty. Also, as we'll talk about later with Part A, if you wait to apply for Part A after you turn 65, it will automatically go backwards 6 months, up to 6 months, which means you need to plan ahead if you are contributing to an HSA to stop the contributions before you apply for Medicare to avoid that overlap. When you sign up for Medicare, everyone begins with this card shown here. This is called your original Medicare card. Always guard this card. Your use of this Medicare card could differ depending on the other types of Medicare plans you ultimately choose, but everyone starts out with this card, and you will need this official card and the number on it in order to join some of your other health plans. The ID number on this card should be protected just like any other credit card or personal identifying number. It can be used or stolen to commit fraud. I also recommend not giving this out on the phone. You will be contacted by many marketing insurance agents who are pretty skilled at asking and encouraging you to give them this number. You do not need to give out this number unless you are interested in joining their plans. Reminder, individuals already collecting Social Security will automatically be enrolled in Medicare before their 65th birthday, and they will be sent this card about 3 months before their birthday month. The envelope it comes in is unmarked, so it's pretty common that sometimes people throw it away, so watch your mail carefully so you don't have to order a new one. If you are automatically enrolled in Medicare, you will receive a welcome packet explaining to you that you are now on Medicare Part A and B and the dates that it will begin. If you're in a situation where you choose not to keep your Medicare, you will want to follow the instructions in this welcome packet, which includes sending the card back and signing that you do not want to keep Medicare and you're declining coverage. If you do not send this back before Part B start dates, you are agreeing to continue to pay the premiums. If dropping Part B by sending back the card, you will be sent a new card showing you are only on Part A as long as it's premium free to you. It's important to write down your Medicare ID number before you return your card to make sure that you have the number in case you need to receive hospital services or other Part A covered services until your new card arrives. In this next part of the class, we're going to start breaking down what each part of Medicare in what I call Medicare basics, understanding the parts and what they cover. This chart gives you a brief summary of what each part of Medicare covers, which are all separated by letters. Medicare's Part A and B are considered the original parts of Medicare. In this presentation, we're going to break down each part and discuss its specific coverage and costs. We're going to follow the alphabet and start with Medicare Part A. Medicare Part A is also known as hospital insurance. On this slide, you can see what Part A is responsible to cover. Part A will pay for inpatient hospital care or inpatient mental health care, inpatient skilled nursing facilities, blood while inpatient, as well as home health and hospice. Part A will usually not cover private duty nursing, a private room unless medically required, and incidentals you receive while in the hospital, as well as custodial care, which is non-skilled related care you might receive in a nursing home. The costs associated with Part A are listed here. It's important to know that these costs can change every year, and the costs on this slide are for 2026. About 99% of people do not pay a premium for Part A. Those who do not have at least 40 quarters or 10 years of work and do not qualify under their spouse's work record can still obtain Part A, but the premium can be expensive. The information about how many quarters you have worked can be found on your annual statement that you receive from Social Security or by calling. There is also a deductible for Part A. In 2026, that's $1,736. The deductible is based on benefit periods. This is not an annual amount. This could potentially happen more than one time per year. A benefit period begins on the day that you're admitted to a hospital, and it extends until you've not been in a hospital for 60 days in a row. If you go home and you are not in a nursing home or skilled setting for more than 60 days and happen to need to go into the hospital for another same situation after 60 days has gone by, this is a new benefit period, meaning you must pay the Part A inpatient hospital deductible another time. Benefit periods can span across calendar years. There are also co-pays when you are an inpatient or in hospital or skilled nursing facility. We'll cover those on the next slides. There is no copayment required for home health care or hospice care under Part A. Under Original Medicare, there is also no out-of-pocket maximum on what your Medicare costs can grow to be. We'll talk more about Medicare supplements or Medigap policies and how that can help limit your risk with these costs. This chart shows the 2026 Part A costs related to an inpatient hospital stay. When admitted and inpatient in the hospital, for the first 60 days, the patient is responsible for the deductible covered on the prior slide, and Medicare pays the remainder of all covered costs. For days 61 through 90, the patient is responsible for coinsurance of $434 for each day. On days 91 through 150, the patient is required for paying $868 per day coinsurance. For days over 150, patients will pay the full cost. Medicare is not a long-term care insurance when it comes to inpatient needs, so it's wise to plan ahead or consider long-term care insurance for this requirement. These are the 2026 costs for a Part A related stay in a skilled nursing facility. These costs require a qualifying stay inpatient in the hospital prior to the admission into the skilled facility. That means 3 consecutive midnights. For the first 20 days, after your deductible has been met, Medicare pays all covered costs. Patients would be responsible for a daily coinsurance cost for days 21 through 100. In 2026, that's $217 per day. Medicare pays the remainder. Medicare does not cover any skilled nursing facility cost after day 100, meaning the patient would pay the full cost to stay in the nursing home. Reminder again, Medicare is not a source for long-term coverage of skilled nursing home stays. Your hospital status is a complex medical decision made by your doctor. This decision also impacts which part of Medicare will be billed for your stay and translates into what your out-of-pocket costs will be. All people will be covered under Medicare Part A as inpatient hospital care when all the following is true. Your doctor's made an official order that says you're going to need 2 or more midnights of medically necessary care to treat your illness or injury, and the hospital formally admits you. You need the kind of care that can only be given in a hospital setting. The hospital accepts Medicare, and the Utilization Review Committee of the hospital approves your stay while in the hospital. If all of that is true, your Medicare will be billed under Part A, and your coinsurance costs will be reflected as we just discussed in the previous slides. If you are not formally admitted as inpatient, you will be covered as an outpatient. This outpatient stay is billed under Medicare Part B. Part B coinsurance looks different, and we'll cover that on future slides. How will you know what your status is? You can ask, but you also must be given a Medicare outpatient observation notice letting you know if you're considered to be as an outpatient in the hospital. Even if you stay overnight, you can still be listed as just outpatient. You should be given this notice if you are expected to be in the hospital for more than 24 hours. Now that we've covered the basics of Part A, we're going to move on to Original Medicare Part B. Part B is also known as medical insurance. Part B is the part of Medicare that is responsible for paying for doctor visits, specialist visits, outpatient medical and surgical services and supplies, clinical tests, x-rays, durable equipment, diabetic supplies, preventative services, and home health. In 2026, the Part B standard monthly premium for Part B is $202.90. This can be higher for individuals who have higher income, which we'll cover on another slide. The premium is typically deducted straight from your Social Security benefits if you are on Social Security at the time you're on Medicare. If you are not, you'll receive bills in the mail. The annual deductible for Part B for 2026 is $283. After your deductible, Medicare will basically cover about 80% of most costs, and you will pay the remainder coinsurance of 20% as long as the provider accepts Medicare assignment. Checking to see if your provider accepts assignment is important. This means that they will take the Medicare's contracted rate for services and your out-of-pocket costs are less. You only then pay the deductible and coinsurance, and the providers will submit your claims to Medicare. If your provider is not a participating provider who accepts assignment, you could be charged an additional 15% of the Medicare approved amount. This is called excess charges. Many preventative services are covered in full and do not require you pay coinsurance. Your Medicare and You handbook has a list of many services. You can find out what their potential costs will be. You can also search for them on medicare.gov. In the enrollment section of the class, I explained to you that understanding your timing for applying for Medicare is really important to avoid late enrollment penalties. On this slide, we talk about how Part B late enrollment penalties are calculated. You would pay a late enrollment penalty for Medicare Part B if you did not enroll in Part B during your initial enrollment period and could have, and you do not have a qualifying group health plan through a job. The penalty is 10% more for each 12 months that you went without Part B and could have had it. This penalty is added to the standard monthly premium amount when you enroll in Medicare, and it does not go away. For example, if you waited 2 full years and you didn't sign up for Medicare, that 24 months is 2 12-month periods, meaning 20% more that you'll pay for your Medicare premium each month. The calculations here show you that for 2026, that would be calculated as the standard amount, $202.90, plus 20%, which is $40.58. So you'll pay an additional $40.58 every month for your Medicare premium. And again, this does not go away unless you're eligible for certain state programs that help you afford your premium. Another variation and difference between the standard monthly premium will be for people who have higher incomes. Since 2007, people with higher incomes have paid higher Medicare premiums. These income-related monthly adjustment amounts, or IRMA for short, only affect about 5% of people with Medicare. This chart below shows you the 2026 Part B premiums for people who have higher income than the base amount. The income they are using is from your tax return, and they're looking at tax returns from 2 years early. For example, in 2026, they're reviewing your IRS tax forms from 2024 to determine what your Medicare premium will be. If you're impacted by this, you will receive a letter explaining that based on your income from this tax year of 2024, your premium will be a determined amount based on the brackets below. It is also important to know that if you've had a change of income since the tax year Medicare is using to determine your premium, you may have the ability to report a change to Social Security and have them adjust your premium. The changes that you can report are on the letters that you receive notifying you of your IRMA amounts and include things such as stopping work, a change in your marital status, death of a spouse, loss of income producing property, and losses of pensions. If one of these changes affect you, they explain that you should contact them right away so they can adjust your premium more timely. Otherwise, changes to the premium will be adjusted each year following the new tax year information that's available. Medicare Part B covers a wide range of different types of exams, tests, screenings, and vaccines that are called preventative services. These are services meant to prevent, find, or manage medical problems. Things that are considered preventative services are covered in full by Medicare and cost nothing to beneficiaries. A good way to find out what is considered preventative is by reviewing your Medicare New Handbook that you'll receive when you enroll in Medicare. The Medicare New Handbook has a lot of different services listed, and you can find things with the little apple that's considered preventative, meaning if that service is something that your doctor thinks is best for you to do, it will cost nothing to you through your Medicare. When you are on Original Medicare, the term of what you might be used to as an annual physical is worded a bit differently. A Welcome to Medicare visit is available within the first 12 months that you have Medicare. It is not a physical. It might be important to tell your scheduler when you call your doctor's office for the first time you're on Medicare and let them know you're now on Medicare so they book your appointment in the proper way. This visit typically includes a review of your medical and social history related to your health, education and counseling about preventative services, including certain screenings, vaccines, and referrals for other care if needed. The items listed will be covered during your Welcome to Medicare visit. This visit is covered by Medicare, including the deductible and copayment. However, if you receive any additional tests or labs or services, the usual deductible and copayments will apply. After your first year on Medicare, all the future years while you're covered by Original Medicare, you're allowed a yearly wellness visit. The focus of this yearly wellness visit is to create and update a prevention plan based on your current health and risk factors. You'll be asked to complete a health risk assessment to help your provider create a personalized prevention plan. This visit is covered by Medicare once every 12 months at no charge. However, again, if you receive any additional labs, tests, or services, your usual deductible and copayment amounts will apply. Asking for this visit by its name, the yearly wellness visit, is important. If you schedule your appointment as a physical, you may need to pay the full cost of a physical. We've covered some of the initial basics of Original Medicare, Part A and B. In this next section, we're going to review your additional plan and coverage options. When you join Medicare, there are essentially two different versions of Medicare that you'll be deciding from. These are narrated here on the slide. On one side, we have Original Medicare. On the other, you have Medicare Advantage, also known as Part C plans. You get to decide which way you want your coverage. Option 1 is where everyone starts, with Original Medicare. If you choose to stay with this option, you will also need to add something for prescription coverage and optionally add a Medigap policy, also known as Medicare Supplements. Medicare Supplement policies help you cover your out-of-pocket costs that Medicare passes on to you. The alternative version, known as Medicare Advantage plans or Part C, is more of a bundled option. It combines your Medicare Part A and B, as well as most time Part D drug coverage all in one plan. With a Medicare Advantage plan, you cannot have a Medicare Supplement or Medigap policy to help you pay your out-of-pocket costs. We'll review each of these options and plans that you will need to add in this next section. we're going to continue on as if your choice, what you've decided, is to stay with Original Medicare. Original Medicare is going to include some of the parts we've already talked about. So Part A and B, you'll have your hospital and medical card. You also need to add something for prescription coverage and a Medigap policy, which is optional, but having the Medigap policy helps protect you from the fact that with Original Medicare, there's no out-of-pocket maximum on your health care costs. Medigap policies help pay part of that for you. With Original Medicare, that being the federal version of insurance, this also means you can use it pretty much anywhere across the country. Majority of providers will accept Original Medicare, so you have really essentially no network, but you still want to ask to make sure they accept Medicare before booking appointments. It's important for you to know that Original Medicare does not cover everything. There are certain services that we know as we age we might need, so we will need to make plans for alternate insurance or understand that we'll pay out of pocket for the following types of services. Original Medicare does not cover most preventative dental or dentures, hearing aids or fitting for aids. It does not cover long-term stays in nursing homes, hospitals, and it also does not cover stays in assisted living or community living facilities. Does not cover most routine eye care or glasses. If you're going to choose Original Medicare, it's important to make plans for how you'll cover the costs of the services on this slide. With Original Medicare, you can choose to add what is called a Medicare Supplement Insurance Policy, commonly known as Medigap insurance. This helps you fill in the gaps and cover some coinsurance costs that are passed on to you by Original Medicare. Medigap policies are provided by private health insurance companies. They're designed to supplement Original Medicare. This means that it helps pay for some of the healthcare costs that Medicare doesn't cover, like your co-payments, coinsurance, and deductibles. If you have Original Medicare and a Medigap policy, Original Medicare pays its share of the Medicare approved amounts for covered healthcare costs, and your Medigap policy pays a second share. You must have Part A and B in order to buy a Medigap policy. Medigap policies only cover one person, but if you and your spouse both want a Medigap coverage, you each have separate policies but can offer a household discount. You still pay the basic standard Part B Medicare premium. Medicare supplements have an additional cost. The Wisconsin Commissioner of Insurance oversees Medigap policies in Wisconsin. You can find more information on their website that's listed on this slide. When you start looking into Medigap policies, it's important to know that there's different types. There are traditional, cost-sharing, high deductible, and Medicare Select policies. In Wisconsin, Medigap policies are unique and different from most of the rest of the country. All but 2 other states offer standardized plans. In Wisconsin, you're able to build your own Medigap policy. All policies start with the benefits mentioned on this slide called the basic plan. The Wisconsin mandated benefits apply to policies that were issued in the state of Wisconsin only. For the basic plan, members can add additional benefits called riders, which we'll discuss on the next slide. In Wisconsin, the biggest benefit of a Medigap policy is the fact that it covers the 20% Part B coinsurance. In addition to the basic plan, you can choose which of the riders you want added to your policy. This is a list of additional riders that can be purchased in Wisconsin. I think it's important to understand what each rider covers so you can make an informed decision on which should be added to your plan. We also have a separate document here at the ADRC that can give you a lot more information about how Wisconsin Medigaps work, and you're welcome to call and ask for that. When you are ready to purchase your policy, you can follow these steps. Number 1 is definitely to understand which of the riders are appropriate for you, so you can explain to the agent or company that you're working with which you're interested in purchasing. Find out which companies sell insurance. When we are working with Medigaps in Wisconsin, the Commissioner of Insurance does have a list of appropriate companies to contact. You can also work with a health insurance agent to do some of that research for you. Call that company or have your agent enroll you in the plan that you're interested in. When enrolling in a plan, it's important to do that during your open enrollment window as well. There are protected times where supplemental companies are required to sell you their policies regardless of your health. Outside of your open enrollment window, they are required to do health underwriting, which means they may or may not be interested in selling you a policy. The best time to buy a Medigap policy is during your Medigap open enrollment period. This is a period that lasts for 6 months and it begins on the first day of the month in which you are both age 65 or older and first enrolled in Medicare Part B. If you apply during this Medigap open enrollment period, you can buy any Medigap policy the company sells, even if you have health problems, for the same price as people who are in good health. If you don't purchase the plan within your 6-month open enrollment period, again, reminder, insurance companies can deny you coverage based on your health condition. It's also important to understand that your Medigap rights may depend on when you choose to enroll in Part B. If you're older than 65, your Medigap open enrollment period begins when you enroll in Part B, and it can't be changed or repeated. In most cases, it makes sense to enroll in Part B and purchase a Medigap policy when you're first eligible for Medicare, because otherwise you might have to pay a Part B late enrollment penalty, and you might miss your Medigap open enrollment period. There are always exceptions if you have other employer coverage. If you're under 65 and enroll in Medicare due to a disability or end-stage renal disease, you're entitled to a second 6-month open enrollment period upon reaching age 65. So again, if you're someone who delayed enrolling in Part B, maybe you enrolled in just Part A and you were covered by an employer-related plan, your Medigap open enrollment period is also delayed until you are enrolled in Part B. Once your coverage ends or your employment ends, whichever happens first, your Medigap open enrollment period begins. Your Part B effective date is what starts your open enrollment period. There are also other protected times you cannot be denied a policy based on your health. If you take advantage of these windows called guaranteed issue periods, you must apply within 63 days of the loss of your other coverage to qualify. Some of those would include your Medicare Advantage plan terminates or stops providing their plan in our area, you move outside the plan's service area, your group health plan ends some or all of your coverage, your employer group plan increases by more than 25% in cost in a year, or you're in an approved trial period of an Medicare Advantage plan. On this slide, we have resources to help you if you still have questions or would like more support or information about Medigap policies in Wisconsin. The Wisconsin Medigap Helpline, you can also talk to health insurance agents, you can talk to the Commissioner of Insurance, or you may call Medicare or use their website to research for more. When using a licensed insurance agent, it'll be to your benefit to understand the Wisconsin policy types and riders so you know what to ask the agent about. You'll also benefit by visiting with more than one agent, as it's likely each agent won't sell policies from all companies that provide Medigaps in Wisconsin. We are now moving on to Medicare Part D. Medicare Part D is prescription insurance. When you transition to Medicare, you are required to have some type of creditable prescription insurance to avoid penalties. Medicare Part D is Medicare's version of prescription insurance. You can choose to join a Medicare Part D plan either as a standalone plan that partners with your Part A and B and Medigap policies with Original Medicare, or they often are included within a Part C plan. The Medicare Advantage plans often include Part D as part of your insurance bundle. Medicare Advantage plans and Medicare Part D plans that offer prescription coverage are run by private insurance companies that have contracts with Medicare. Medicare Part D plans cover just prescription medications. Prescription medications are also needing to be on the plan's formulary, so each plan will have a list of covered medications, meaning not every medication is covered by every plan, so picking a plan that covers what you're taking is really important. The law excludes certain medications from being able to be covered under Medicare Part D. Medications must also be used for how they're medically prescribed to be used to be covered. Medicare Part D also covers insulin and the supplies that you need to administer insulin at home. As of January 2023, Part D plans also cover certain vaccines that are administered through a pharmacy. The most common ones are Tdap and shingles. The Inflation Reduction Act eliminated all cost sharing for these recommended vaccines that are under Part D coverage. All Part D plans are also required to cover a range of prescription drugs that people with Medicare might take, including drugs in certain protected classes, like drugs to treat cancer, HIV or AIDS, or depression. There are some types of medications that Part D plans cannot cover. This would include medications that might not be on your specific plan's formulary, non-prescription or over-the-counter prescription medications, drugs that are not approved by the FDA, vitamins and minerals, cough medicines, ED medications, and drugs that are used for cosmetic purposes only. Also, off-label use of prescription medications may not be covered by your Part D plan. For example, if a doctor prescribes a medication for a condition but the FDA has not approved the use of that medication for that condition, then the prescription drug may not be covered, even if it's on your plan's formulary for use with other conditions. There are designated times where you're allowed to join or enroll in a Part D plan. These are important to understand so you can avoid late enrollment penalties. The most common is the initial enrollment period. This is the 3 months prior, month of, and 3 months after your 65th birthday. You can also change your plan during the annual open enrollment period that happens each October 15th through December 7th. Changes or enrollments during this window are effective for January 1st the following year. Individuals on Medicare Advantage plans have a window January 1st through March 31st each year called the Medicare Advantage Annual Election Period. There are also a list of special enrollment periods. These are times outside of the other open enrollment windows where individuals can qualify to join a Part D plan and avoid late enrollment penalties. The cost for Medicare Part D plans might include premiums, deductibles, and copays or coinsurance. Some plans may not have a deductible or may choose to have a lower deductible. The maximum deductible that a plan can have in 2026 is $615. Copays and coinsurance will vary based on drug, the tier of the drug, the plan, and pharmacy. Each plan can have a different formulary, which is the list of medications they do or do not cover. Picking a plan based on your specific medication needs is important to ensure the plan will cover what you need. The costs associated can change each year, which is why we encourage everyone on Medicare to do a review during the Medicare open enrollment windows. In 2026, the premiums for plans available in Door County for original Medicare Part D plans vary from $0 a month up to $113.90 per month. Again, which plan you pick will be prescribed by which medications you need it to cover. The national base average premium for Part D plans is $38.99. This dollar amount is what's used to calculate late enrollment penalties for those that are subject to it. Another variation to what these basic premiums might be are for those that are subject to the IRMA. If you are someone that was subject to the IRMA that we discussed with Part B coverage, you will also have an additional premium to pay for your Part D plan when you enroll. Making sure that you have the right type of prescription insurance is really important. Medicare has some rules that if you don't enroll in a Medicare drug plan and don't have other creditable prescription insurance, you will incur a penalty. This late enrollment penalty is 1% for each month that you went without coverage. This 1% is multiplied by the current average national monthly premium and added on top of the current monthly Part D premium for the plan you join. This late enrollment penalty will continue for as long as you're on a Medicare drug plan as well. We have an example here that if you went 20 months before you joined a Medicare drug plan and had no other creditable insurance, you will pay an additional $7.80 on top of the Medicare drug plan that you joined's premium. This combined premium you will pay again as long as you're enrolled in Medicare. If you have other creditable insurance, you'll want to compare that to see if it's better than joining a Medicare drug plan. Other creditable prescription insurance could include veterans drug coverage, Wisconsin Senior Care, which is another state-based prescription plan, or certain types of employer coverage. If you're not sure if the plan you have is creditable, you will want to check with your benefit administrator to confirm before declining Medicare Part D. The cost of your Part D covered medications can change throughout the year depending on which phase you are in. Medicare Part D plans have 3 different phases. The first is your deductible period. Until you meet your Part D deductible, you will pay the full negotiated price for your covered prescription drugs. Once you've met the deductible, the plan will begin to cover the cost of your medications and you will pay copay amounts. While deductibles can vary from plan to plan, no deductible can be higher than $615 in 2026. Some plans have no deductibles at all. Each plan will have a different number of tiers of medications. Some plans do not require you pay towards your deductible for the lowest tiered medications. Once you've met your deductible, you'll move into the initial coverage period. During this period, you will pay coinsurance or copayment amounts for your covered prescriptions. In 2026, this initial coverage period ends after you've accumulated $2,100 in costs out of pocket. Once you reach this amount, you'll move into the catastrophic coverage phase. During this phase, your plan will pay 100% of covered medications and you will pay zero. All Medicare drug plans have a Medicare prescription payment plan option. This is a newer option that you can enroll in and it helps you spread out the cost of your medication copays over the course of the year. You enroll with your plan, and instead of paying at the pharmacy for your copays, your plan will send you an adjusted monthly bill. This doesn't save you money necessarily, but helps you spread out the cost. We've now made it through each of the different parts that are associated with Original Medicare. To recap, that was Medicare Part A, your hospital insurance, Part B, your medical insurance, a Medicare supplement, and Medicare Part D drug coverage. In the next section, we're going to look at the alternative called Medicare Advantage. Medicare Advantage, or sometimes called Part C, include both Parts A, B, and usually Part D all in one plan. Essentially, when you join a Medicare Advantage plan, you're opting out of Original Medicare and using a private insurance company who has contract with Medicare to oversee your Medicare. These plans are network-based plan, meaning you must use the plan's doctors, hospitals, and providers to receive your coverage. In Door County, there are a total of 38 different types of Medicare Advantage plans. As I mentioned, there's quite a few Advantage plans available in our area. All of them require you use some type of network. Medicare HMO plans have provider networks that you must get your care and services from in order for the plan to pay for your care. If you get care from outside of the network, you may have to pay full cost. HMO plans typically also require you assign a primary care provider. You must use your primary care provider for referrals to specialists. Preferred provider organizations, or PPOs, usually don't require a primary provider, and you don't need referrals. They do have a network of doctors and hospitals, but with a PPO plan, you can also use out-of-network providers for covered services, usually for a higher cost. Medicare private fee-for-service plans allow you to go to any Medicare-approved doctor or hospital that will accept the plan's terms and agree to treat you. Medicare special needs plans are designed to provide focused care treatment, special expertise of the plan's providers, and benefits tailored to specific groups. typically including individuals who may be living in a nursing home, who are eligible for both Medicare and Medicaid, or people with specific chronic or disabling conditions. Medicare Medical Savings Accounts, or MSA plans, combine a high deductible health plan with a bank account. Medicare deposits a specific amount of money into the account that you will use to pay for your health care services. If you decide to enroll with a Medicare Advantage plan, you are still have the same rights and protections that you would with original Medicare, but you must follow the plan's rules and how to get services paid for. This could include referrals to see specialists, prior authorizations. You must also use the network. These rules can change each year. You may choose a plan that includes prescription drug coverage. Medicare Advantage plans can't charge you more than original Medicare for certain services such as chemotherapy and dialysis. Each Medicare Advantage plan may have different benefits and cost sharing. You may choose a plan that includes extra benefits such as payments for vision or dental, which are not covered by original Medicare. You cannot use a Medigap policy when you enroll in a Medicare Advantage plan, meaning you will have obligations to cover the coinsurance costs on your own. Regardless of which version of Medicare you go with, you will always continue to pay your Medicare Part B premium. Medicare Advantage plans will also have different costs that are associated with it that vary quite a bit from original Medicare. With a Medicare Advantage plan, some other costs you may have to pay is an additional monthly premium to join the plan. All plans also have different costs for deductibles, coinsurance, and copayments. These amounts could be higher if you go outside the plan's network. Medicare Advantage plans also set out-of-pocket maximums. This is an amount for health services that if you reach by paying your out-of-pocket coinsurance, you will not have to pay anything for health services the remainder of the year. Door County plans in-network range for out-of-pocket maximums are anywhere from the low end of $1,500 for the year up to over $9,000. This is an amount that you will want to understand before enrolling in a plan. When making your decisions about which type of Medicare coverage you believe will work best for you, we always try to point out some of the pros and cons of each version, keeping in mind that your decision is very specific to your needs, including your budget, the types of insurance networks that are important to you, or not having to use a network. So here's just a list of some of the common pros and cons of Medicare Advantage plans. With a Medicare Advantage plan, it may be an advantage to have a lower monthly premium. Many of the Medicare Advantage plans don't charge you anything beyond your standard Part B premium each month, so that might feel more affordable. They also are supposed to help coordinate care between your insurance and your providers. These plans typically offer benefits that exceed what standard Medicare will pay for, some of the most common being some limited coverage to help preventative dental and vision and hearing. They do set an out-of-pocket limit or an out-of-pocket maximum on what your potential spending might be each year, so that provides you some protection on what your out-of-pocket costs for medical visits could grow to be. Medicare Advantage plans are also required to follow regulations set by CMS, or the Centers of Medicare and Medicaid. Something that is kind of a positive and a negative would be that there are quite a few plans to choose from as well. So about 38 different types of Medicare Advantage plans in Door County this year of 2026. So that could be a good thing where you have a lot of choice. It could also be a disadvantage, as that's a lot to try and wade through to figure out which plan might be best for you. A disadvantage could possibly be that you could end up paying higher out-of-pocket expenses over the course of the year if you have a plan with a higher out-of-pocket maximum and end up meeting it. You could potentially pay more than you would have with original Medicare. A disadvantage is you could have higher costs if you go out of network with your plan. Another disadvantage regarding networks is the networks for Advantage plans are not locked in for any period of time. So your provider might be in the plan when you start it, but it might drop sometime during the year. that change doesn't necessarily give you the chance to change your Medicare plan as well. So that could be network changes that affect your ability to stay with the doctor you choose. And another would be that these plans are annual contracts. So a disadvantage will be that you should review them each year to make sure that the plan you're in is still going to work for you for the following year. If you're still here with me, congrats. We've now made it through the basics of original Medicare parts and the Medicare Advantage plan options. We're going to move on and talk about what to consider if you have other insurance options that you can coordinate with your Medicare. Some of you may have other types of health insurance that you are going to be allowed to keep or enroll in once Medicare eligible. So individuals that are still working, we've covered that in the first part of enrollment and choosing to decide if you want to enroll or delay enrollment to keep your group health plan. However, once you retire, some will have the options to keep employer retiree coverage. It'd be really important to talk to whoever administers this plan, this retiree plan, to ensure that you understand their coverage rules, the costs of the plans. It likely requires you still enroll in Medicare, but could be a secondary insurance. So you'll need to make sure that their coverage is creditable. You may be a veteran and have options to join TRICARE or the VA health programs. It's important to talk to your local veteran service officer about your options or what you might be eligible to enroll in, and understand that that also usually requires you be enrolled in Medicare. Medicare doesn't always coordinate with all types of VA health programs, so you'll want to do that research before enrolling in Medicare. And then medical assistance or Medicaid is available to help individuals who have lower income and lower assets. This can be, again, another insurance option to help with some of the out-of-pocket costs that Medicare would pass on, or possibly even help you pay for your Medicare. For prescription insurance, another option for Wisconsin residents is called Wisconsin Senior Care. This program is available to Wisconsin residents who are age 65 and older, who are U.S. citizens or qualifying immigrants. This program has no open enrollment window, so you can apply for it at any time. This program is a $30 annual premium, so there is no month-to-month cost for this prescription insurance. It is considered a creditable type of prescription plan. The amount of what you pay for prescriptions is the same, but whether or not you owe a deductible is determined based on income. There's different tiers and different levels based on your annual income. This is a benefit that we can help people understand more, help you apply for, or help you compare to see if this is a better option or maybe should be added in addition to Medicare. Fall open enrollment, also known as the annual election period, is a period each year from October 15th through December 7th where you can change your Medicare coverage. During this period, you can either join a plan if you haven't before. You can switch your Medicare Advantage plan to a new Advantage plan. You can also switch between Advantage plans back to original Medicare and join a Part D plan, or change your Part D plan during this window. Any changes made during this period are effective for January 1st the following year. Each year in about September, your current plan should be sending you an annual notice of change or an evidence of coverage booklet. This is your chance to review your current plan to see what's changing for the upcoming year. Even if you're satisfied with your current coverage, it's important to look at all the options in your area, as you may find a plan that better suits your needs or lowers your costs. Research shows that people with Part D could lower their costs by shopping around between these plans, but many do not understand that they have this option. Medicare Part D plans and Medicare Advantage plans are one-year contracts. Everything about them could change as far as their networks, doctor networks, cost of medications, formularies of which drugs they cover or not. So it is really important to take opportunity of this window to make sure you're still in a plan that's going to cover you well for the following year. And there's a lot of help available to help you with comparing your plans, so you're not alone. If you want to do it yourself, you can find information about all plans that are available based on where you reside through Medicare's website, medicare.gov, or by calling Medicare directly. They are open 24 hours a day and can help people understand the plans that are available and help you look up information about plans. Their phone number is 1-800-MEDICARE or 1-800-633-4227. That's listed on the slide. You can go through the Wisconsin Medigap helpline, which is also part of the SHIP program. They're available to help people do plan comparisons and understand their choices, also by phone. Or you can work with a local health insurance agent. That's someone that you trust. And here at the ADRC, the SHIP counselors also provide assistance with plan reviews during open enrollment. So a lot of good options to help you if you need more help comparing your plans. Medicare.gov is a tool that I use when helping people explore their Medicare plan options. So if you're comfortable using the computer, visit Medicare.gov. Once you receive your Medicare number, you'll be allowed to create yourself an account on this page and save some of your information, and you can use it to monitor your benefits, enroll in certain plans, check on claims, and other helpful things. If you go to Medicare.gov, we use what we call a plan comparison tool. The plan finder will help walk you through the steps and find and compare plans based on your medication information, pharmacies that you use, and help you get an estimate of what your costs for each prescription would be for the year based on each plan. You can enroll in a plan online for Medicare drug plans or Medicare Advantage plans. It'll also help you contact the plan directly by giving you their phone numbers or their direct websites if you're trying to find more specific information about a particular plan. When it comes to affording Medicare, it may not be easy for individuals who have fixed income and limited assets. So here we're going to just go over briefly a few programs that might be able to help. If anyone is having challenges or interested in knowing more about these programs, this as a benefit specialist is something that I help people explore and sometimes help them apply for these programs. So the first one listed here called Medicare Savings Program. So each of these programs kind of have some income restrictions and limits on assets. So those are going to be listed separately, but essentially if you're eligible for the Medicare Savings Program, what it does is helps afford the Part B premium. So the $202.90 a month can be covered by this program. Some people that, because there's different categories, in the kind of most helpful category, it can also help them pay their deductible and co-insurance costs, so essentially kind of covering everything that Medicare would pass on to the beneficiary. The second program, called Extra Help or Low Income Subsidy, is a program that can help reduce the prescription part of Medicare, so the Part D costs, by lowering the premiums and keeping the copays for medications lower. And Senior Care is another program that may be something to enroll in place of your prescription insurance or in addition to help with cutting down some of the costs of medications. We look at this program, especially if maybe someone has really high medication costs, to help them as a secondary insurance, or sometimes help enroll in to cover medications that might not be being covered on the formulary of their Part D plan. All these benefits are things, again, that if someone thinks they might be eligible and just isn't sure or needs to talk to someone about the qualifications or are struggling with applications, benefit specialists are a good resource to help through that process. This chart shows just some of the eligibility guidelines for the programs we just discussed. This is being recorded on January 15th, 2026. The income limits for some of these benefits do shift each February, so they likely will go up just a little bit from the time of this recording. There are different levels for each of the programs listed here, so this chart just shows the highest income and asset limits that you can have in order to potentially qualify. So if someone thinks that they're kind of close to this or isn't sure which kind of assets to include in the totals here or not, again, just encourage you to contact a benefit specialist for more help. We do have fact sheets about each of these benefits and can provide them if you're interested in learning more or need to know how to apply. You can contact the ADRC. In this part of the class, we're going to talk more about Medicare fraud. The Wisconsin Senior Medicare Patrol is an organization that we work with, and their goal is to help beneficiaries prevent, detect, and report healthcare fraud. Their goal being to preserve the integrity of Medicare and Medicaid programs. We hear all the time that there's federal dollars that are lost annually due to healthcare fraud, errors, and abuse. So their goal is to help teach Medicare beneficiaries how to protect their personal information, how to report errors on their healthcare bills, and how to identify deceptive healthcare practices. That could include illegal marketing, providing unnecessary services, or charging for services that were never provided. So some steps here that they recommend is not giving out your Medicare number except to your doctor. As I mentioned earlier, you will receive marketing phone calls, and they're pretty skilled at convincing you that they need your Medicare number. This is not true unless you explicitly are interested in wanting to enroll with their plans. So keep that number nice and safe. Treat it just like a credit card. Don't give that out if someone's calling you and saying they're from Medicare and they just need that number. That wouldn't happen. So don't feel like you have to give that out over the phone. Step 2 will be to detect fraud. You will receive Medicare summary notices. It's good to always take a look at those. These are not bills, but show you a listing of medical services that were billed through your insurance. You can also access those if you set up an account on the Medicare.gov website. The Senior Medicare Patrol encourages you keep a journal of your healthcare visits so you can compare that to your Medicare summary notice and make sure everything looks appropriate. This is an example of a Medicare summary notice. This is sent to people with original Medicare. It may look different if you are with a Medicare Advantage plan, but essentially it should state on there that it's not a bill. You can make sure that your name and your address and Medicare information looks accurate. Again, just take a look and make sure that you received each of the services that are being listed on this notice. If your claim is being processed and paid, it will explain if it's denied what to do next. Might include calling your doctor office to check. Sometimes there's just mistakes and the claim was not coded the right way. If it wasn't done properly, the provider's office can adjust it and resubmit your bill for you. If you see a claim that's denied, your Medicare summary notices will also explain to you that you have rights to appeal the decision. The instructions and timeframes that you're allowed will be explained on these Medicare summary notices, so it is really important to take a look through them. And step 3 would be to report suspected Medicare fraud. So if you notice something that on those Medicare summary notices doesn't seem, maybe it's a service you never did, or they're billing you for supplies or services you never received, you will want to call again the provider that's listed and check in with them to see if it was a mistake. You can gather your documentation such as your health journal or other billing statements. If the issue isn't resolved, you can contact the Wisconsin Senior Medicare Patrol for free and confidential help. Call them toll free at 1-888-818-2611. We are almost to the end of class, so I will do a quick recap here, just going over what you've learned today. We've got 2 versions of Medicare to decide between. We have Original Medicare. This is where everyone will begin. When you submit your application for Medicare Part A and B, you begin with Original Medicare. With Original Medicare, this is the federal version of Medicare, meaning you can use it anywhere that it's accepted across the country, so there's no network per se. You will join a separate coverage plan for prescription insurance. So you can either join a standalone Part D plan. Those are private insurance companies that have prescription insurance that are contracted with Medicare. You may also have some of those other insurance options that we went over, such as senior care, employer retiree coverage, veteran coverage. And then to help you pay your out-of-pocket costs that are passed on to you by your original Medicare, you can also choose to enroll in a Medigap policy. Those Medigap policies are meant to help protect you because with original Medicare, there is no out-of-pocket spending limit on what your coinsurance costs could be for the year. In the alternative option, you can also join a Medicare Advantage plan. Medicare Advantage plans are private insurance companies that have contracts with Medicare to offer you your coverage under a plan called Part C. Again, Medicare Advantage plans usually bundle together your Part A, B, and D all together. They work very much like a group health plan, whereas you have a coinsurance or copay amount set for pretty much anything you could think of between doctor visits, labs, x-rays, etc., and you are responsible to pay that copay amount. Medicare Advantage plans do set a cap on what your out-of-pocket copay amounts can total to be for the year for health and medical services, meaning if you reach that cap, your plan will pay the remainder of covered services for the remainder of that year. Medicare Advantage plans do have networks, so you do need to make sure that you are seeing people that accept your plan to avoid paying out of pocket. And these plans often cover extra benefits that original Medicare do not cover, like preventative vision, dental, and hearing. And you did it. You made it through Welcome to Medicare class. Remember, learning about insurance is a journey. Medicare is a pretty complex system compared to other types of insurance, but luckily you have a variety of options to help you get through it. Listed here is a slide of just some contacts to keep handy and utilize while you continue your Medicare planning. CHIP counselors can help provide you that unbiased guidance and assistance with Medicare. Benefit specialists also can help with other public programs. The ADRC offers a wide range of other types of assistance, support, programs, and classes. So the best way to stay in touch and know what we've got going on is to visit our website. You can also read our monthly newsletter or follow our Facebook page. Printed copies of the ADRC newsletter are available at many drop-off sites across the county, but you can also receive it by email monthly. If you'd like to receive that newsletter, contact the ADRC to be added to that list. I really hope you found this information helpful as you continue to consider your Medicare options. If you'd like to meet with a CHIP counselor, please give us a call at 1-920-746-2372. Thank you.